All right, joining me now is Dr. Paul Spiegel, who's the director of the Johns Hopkins Center for Humanitarian Health. He's also worked with an NGO over at the Rafah border and recently returned to the United States. Paul, it's great to have you on the show and speak with you. I want to begin by asking you your account of the situation on the ground in Gaza. What did you see there?
Thank you. I was primarily based in Cairo with the UN, and what we saw, and speaking to the Gazans, healthcare workers every day, was really shocking and remains shocking. The lack of food, water, fuel, unable to come in after now over 100 days, together with the constant bombing and there are areas that are just not secure. They're told that some areas may be secure and that they're not. And many of these bombings are hitting the healthcare system, the hospitals, and the health centers. So even with the group that I was working with, the numbers of health centers have reduced dramatically, and the access to basic healthcare and food is really reduced to a point where it's critical at this point.
From a humanitarian perspective, Paul, the attention that Gaza is getting right now, compared to what it was, there's a bit of a difference, because even before October 7th, I mean, Gaza was part of the world that was heavily dependent on outside aid being delivered to the enclave. I think it was around 500 trucks were entering the enclave a day. More than 3 months into this conflict, it is only a fraction of that, and we're seeing some of the devastating effects of that in terms of the spillover, the spread of disease, the inability to treat patients that are being wounded. This is a very unfortunate situation.
Yeah, I mean, it's astonishing, because even right now, if there was a ceasefire, the amount of aid that would need to come in would be extraordinary, and humanitarian assistance alone would not be able to deal with this. One aspect is food, and right at the end of December, an IPC, an important report that examines famine, came out and said that 1 in 4 households in Gaza are currently suffering extreme hunger, and even 26% are actually on the verge of famine. And so humanitarian assistance is not able to get in sufficiently now. It's less than about 100 to 150 trucks a day, and that's been over a long period of time. So the amount that is needed is incredibly high. There are already cases of waterborne diseases, because the people that are living in shelters, the water and the sanitation is so poor. And even if there is, which we hope there will not be, but it's very likely there will be a big waterborne epidemic, it's going to be extremely hard to respond given the lack of water and sanitation and the inability to bring in supplies.
So clearly there's an insufficient level of humanitarian aid, but that's just part of the story. When you look at, I'm sure you had a chance to listen to our lead story. There was a soundbite that we played from a World Health Organization representative, where he said, look, there's already 60,000 injured people and we're playing catch up, 200 new injuries added every single day. And when you only have a fraction of the hospitals, and they are functioning not fully, but on a partial basis, it makes it extremely difficult to treat these people.
Yeah. Yes. I mean, there are a lot of issues. Number one is that many hospitals now, as you mentioned, are only about a third, at least a couple days ago, or only partially functioning. And out of those, you have they're insufficient beds, so they're at least 300% overoccupied. On top of that, they don't have sufficient medical personnel, as well as supplies and medicines, to adequately address this. And so we've been speaking with colleagues on the ground in terms of trauma, and many of the very serious trauma cases, head trauma, trauma to the body, people aren't, if they make it to the hospital, which is a big if, they're not able to be treated adequately. And so many of those people are going to die where they shouldn't. And so a lot of the trauma that we're seeing now are those that have perhaps survived the worst part, and it's a lot more in terms of extremities. And there's even a huge amount of amputations that in peacetime should not be occurring when there would be adequate care.
Talking about amputations, I mean, a lot of these amputations, I think it was, I was reading a report by Save the Children that 1,000 children have had to have been forced to sort of amputate one or both of their limbs. I think it was legs that they were talking about. But a lot of these haphazard operations are being done under without the use of anesthetics, and that is it's alarming.
Yeah, of course. No, it's the idea of having to do this without anesthesia or minimal anesthesia is very alarming. But on top of that, I think what is not discussed is that, so number one, these are occurring when in theory they shouldn't. But then the second aspect is that there will be a lot of secondary infections of limbs that will then result in amputation even after operations because of the insufficient medication, antibiotics, as well as water and sanitation. And perhaps if I can add, the other area, everyone is understanding or understandably focusing on trauma, but there are many, many people in Gaza who have had non-communicable diseases, diabetes, big hypertension, kidney dialysis. And traditionally, what we see in most conflicts, and starting now and continuing, is that these people will be dying as much, or even in many situations, much higher numbers of these what we call indirect causes of diseases that are secondary to the direct trauma.
All right, Dr. Paul Spiegel, thank you very much for joining us here on TRT World. I enjoyed speaking with you.